Thank you all so much for being here. My name is Chelsea Kimura. I am the Training and Technical Specialist with the Northwest ATTC, and I will be supporting today's session. My colleague Lindsay is also on with us, so if you have any technical issues or questions during the session, please don't hesitate to message either one of us in the chat. Before we begin, I do want to mention that this session is being recorded. The recording will be posted on our website in just a few weeks so that you can revisit it or share it with others. And a quick reminder, if you'd like to receive a certification of completion, please stay with us for the entire session so that we can meet our credentialing requirements. I'm very excited to introduce our presenters, but before that, I do have a land acknowledgement to share with you all. So can we go to the next slide, please, Max? Thank you. Our work intends to reach the addiction workforce across HHS Region 10, which includes Alaska, Idaho, Oregon, and Washington. This region rests on the ancestral homelands of Indigenous peoples who have lived and cared for these lands since time immemorial. We do invite you to join us in honoring tribal sovereignty and in expressing respect and gratitude for our Indigenous neighbors. We are all joining from very different parts of the Northwest, and I personally reside on the traditional lands of the Siletz, the Grand Ronde, the Umatilla, and Walla Walla tribes. I do encourage you to take a moment to look up the Indigenous homelands where you live and share them in the chat if you like. Lindsay did just add that link to the chat in case you're interested in looking up where you're located. All right, thank you, Mac. Next slide, please. Okay, for those who may be newer to our network, this map shows the ATTC network across the United States. The network includes 10 regional centers and a network coordinating office. Our team works in the Northwest, serving Alaska, Idaho, Oregon, and Washington. We are funded by SAMHSA, and our mission is to support the adoption and the implementation of evidence-based treatment and recovery practices through training, education, and consultation. Next slide, please. All right, we do have a quick pre-survey for you all, so if you can scan that QR code, Lindsay will also add that link to the chat for you to access. It should take you just a minute or two to complete that survey, and then we'll have a very brief survey at the end of the session today as well. All right, next slide, please, Max. Okay, now it is time to introduce our presenters. So we have Tony Vezina. He's the executive director of 4D Recovery. Tony leads 4D's network of peer-led recovery centers, advancing adolescent and young adult recovery and workforce development. Under Tony's leadership, 4D is building Oregon's first adolescent and family recovery campus, combining detox, residential treatment, outpatient services, family therapy, and peer support all under one roof. He also trains peers for certification through Peer Solutions. And we have Max Seger. Max is the HR director at 4D Recovery. Max brings a multidisciplinary background and people-centered approach to HR. Max focuses on employee care, collaboration, and professional growth, helping 4D expand from 45 to over 160 staff and earn recognition as a top workplace for training and development. And with that, I will go ahead and pass it over to you, Tony and Max. Thank you so much for being here with us.
Yeah, absolutely. And, thanks for inviting us. And it's actually pretty cool. I do a lot of presentations, but I rarely, and maybe it's the first time, get to present with Max, so I like to call Super Max. It's just really awesome, does a ton of great work, and has really been instrumental in helping us shape our organization to balance sort of quality care, and excellence, and also like a good healthy culture where individuals are given an opportunity to thrive and develop. And I'll let Max talk a little bit more about that later. It's good to see everybody here. Okay, we got some people from Oregon, Seattle. That's cool. Someone from the Oregon Youth Authority. Mike, what's up? SOR program coordinator. Okay, I'll touch a little bit about SOR funds in here then. Snohomish County. Yeah, I know when I was in treatment back in the day, there was a lot of people from Snohomish there in Vancouver. Got some more people from Portland. Great. Well, thank you guys so much for coming. My name is Tony, and I am the executive director of 4D Recovery, and I'm in recovery. I've been in recovery for a little over 13 years, and I was fortunate enough when I first got sober to go to this place called 4D, and it was in a warehouse, and it was like just a bunch of young people hanging out, and got the opportunity to help form a nonprofit, and then some professionals in recovery, like some lawyers, some business professionals, some individuals from the local Multnomah County Behavioral Health Department, and then this guy Eric Martin, who uh, runs our non-governmental behavioral health, non-licensed behavioral health certification board here in Oregon called MacBo. They kind of helped us young sober people build a nonprofit. And this is a long time ago, and then I got lucky enough to help in that, and then be able to grow and develop and be the executive director. But all the things that 4D accomplished is not a result of me alone. It's been a community effort, and I have great staff, and people like Max and the rest of my staff are just really committed to helping people. So a little bit about 4D, and I'll get into it a little bit more, but we're what is what in Oregon is called a peer-run organization, which is the equivalent to kind of what a national term called a recovery community organization is. And it basically means it's run and operated and staffed by a majority of people in recovery. The majority of people who work at 4D are in recovery. Not everybody, but the vast majority, probably 90%, I would say. And then everybody on my board of directors is in recovery. And really, our mission is to help people with substance use disorder find recovery and achieve the best version of themselves that they can. We started off just doing recovery services, and I'll go through a little bit of that in a minute. And then as we grew and grew, we seen more need, and we expanded. In addition to the services that we provide, we fiscally sponsor and provide technical assistance to 4 other organizations that do similar services. One's Painted Horse Recovery. They're really awesome. I think they're going to present in the future. They do Native American recovery service stuff. We got True Colors, who works with LGBTQ folks. The Gorge Recovery Center, they're a rural organization. And then El Jardín, formerly Northwest Institute of Latino, who does similar work with individuals who speak Spanish. So we've been able to do a lot and support a lot of people, including other organizations. And that's really driven by our recovery ethos of carrying the message to people in recovery and giving back to the community and wanting to make things better. You go to the next slide, Max. So these are our current service domains. So we were founded on peer support, and I assume everybody here knows what that means. One person in recovery helping another, professionalized 12-step person, kind of not quite a counselor, but a little more professionalized than like a sponsor or something like that, or a recovery support member. And most of our organization is individuals who are peers. We are growing our clinical services, which I'll talk about a little bit more in a minute. We have a couple different housing complexes. One is a 40-unit single resident occupancy post-residential. It's a substance use disorder residential treatment facility where the majority of everybody going there is coming out of residential treatment, continuing on in outpatient services, mostly with us, but people can select whatever provider they want. A lot of them go with us. We don't have a residential yet, so we partner with local residential. And the idea behind that was to free up sort of a system clog that was happening. So withdrawal management was getting clogged up because residential treatment was getting clogged up, and people didn't have somewhere else to go after residential. And so we pitched this this concept to one of our Medicaid management organizations here in Oregon. We have a CCO model where multiple different agencies run the Medicaid benefit based on geographic location. and they saw the value in it. And so individuals can chill there for, you know, probably about a year, but people end up leaving a little earlier after they become self-sufficient. And then we have two other IOP houses that are for individuals in our intensive outpatient. We have recovery centers all over the place. I'm going to talk about those here a little bit more, the difference between the recovery centers and traditional treatment. Focus on adolescents and then young adults. For adolescents, it's 13 to 17. For young adults, it's historically been 18 to 35. Although we are expanding our age demographics to include some older adults and then doing specialized services for individuals 18 to 25. We have co-capable uh, behavioral health services. And what that means is that we're primary um, substance use disorder, but we do provide some co-occurring mental health. We just don't specialize in like psychiatric care or, for services that people with severe and persistent mental illness may need. We do a lot of public education, advocacy, and policy development as an organization. So we're heavily involved in shaping public policy and public opinion to increase access to services and increase the awareness of recovery and decrease the stigma. We've helped start the recovery high schools here in Oregon. We helped launch the first statewide advocacy organization called Oregon Recovers. And so for us, it is about delivering to the clients we serve, but we have an interest in the welfare of the entire community, and we use our resources to that end. You can go to the next slide, Max. So here's our current capacity in the Tri-County area and in Oregon. That's three of the major cities that are connected geographically. We call it the Tri-County area. We have that 40 unit sober living I talked about. We have those other sober living IOP residential units. We have one young adult outpatient treatment facility. We have one adolescent outpatient facility. We do street outreach and interventions. So we partner with public safety to do sort of pre-jailing interventions with people they would likely arrest. And then also we just do regular street outreach to individuals who are facing homelessness. We got 4 drop-in recovery centers in the area. And then soon, and what I'll talk about later, is our adolescent family recovery campus, which I'm really, really excited about. We also have some drop-in centers in Southern Oregon, down along the I-5 corridor, and then one in Southwest Washington in the Vancouver area. And then in Marion County, where our state capital is in Salem, we have a adolescent outpatient and drop-in center that's co-located with Oregon's third and newest recovery high school. And so we have a building we separated. We got the school on one side, and then we got our clinical services and our peer drop-in center on the other side. It's slated to fully open and be operational 12/1. We have some aspirations for what we're going to be able to accomplish, but and some ideas on how it'll work, but we haven't practiced it yet. So there's going to be a lot of learning for us on throughout the way. Essentially, you could think of our organization on sort of this continuum where we're like intervening, engaging folks who have substance use through our outreach, education efforts. We have the treatment, for individuals who want it to help get them stabilized. And then we have our long-term recovery supports to help people achieve long-term recovery. And it's really important for us to provide that continuum of care. Research shows us that if you can help a person get to the 5-year mark of recovery, their likelihood of having recurrence of symptoms drops down to about 10-15%, which is the equivalent of developing a disorder in the first place. So we really have sort of a chronic care approach to helping people with substance use and co-occurring disorders. You can go to the next slide, Max. Many people here may already know this, but I like to use these slides. I've been using them since I started 4D. I've kept the same slide format. you have this traditional acute care, clinically driven model of treatment, which is great. You know, you get an assessment by a clinician, you get a, prescription to services, you do some therapy, some rehab, like whatever you want to say. You go through it, you do your appointments. And then when your acute symptomology decreases, then you're linked to supportive services and you graduate, and that's the goal. And that is great, and it helps a lot of people. It helped me. Go to the next slide. And where we started is in these recovery centers. Now, recovery center isn't a standard term, so you'll hear it used, to describe different services, different service models. Some of it's like holistic care that's provided. Sometimes it's a residential center, so it's not standardized. But for us, when we're talking about recovery centers, these are places that put a face on recovery, where you can see other recovery people. They assemble local recovery communities. So we want to get all the people in recovery to come in, be a part of the recovery center, and to hang out and socialize. And what we're leveraging here is this, the social model of recovery versus the cognitive model of treatment. We're able to respond to community needs really quickly because we're talking to the community all the time. Work in partnership with mental health and substance use providers, so that people have places to go post-treatment. A lot of social activities, a lot of fun stuff, especially for young people. It's like the same stuff people would be doing in general, but without drugs or alcohol. And they really work as a safety net for a couple different reasons. One is they ensure that the clinical intervention that happens and the success that people make is sustained when they leave. We know exiting treatment is a critical time for occurrence of use, overdose, going back to jail, going back to the streets, etc. It's really a landing pad for people to sustain that and then flourish. And then the other thing is that they're easy access. You can come in the way that they're paid for. And I've seen somebody here what had something to do with state opioid response dollars. In Oregon, our state opioid response dollars have went to a lot of recovery centers. And so it's been flexible funding where people don't need diagnosis. You don't have to demonstrate medical necessity. You don't have to argue with insurance companies about getting payment. People can just come in when they want. And so it acts as a safety net because people just walk in and get help, or, maybe they come after treatment, they have a little, trip on the recovery journey, and then they just walk back in. It's a really friendly place. They can just come in and get help. So it acts as a safety net to get people back on the road to recovery quickly. Go to the next slide, Max. And so the cool thing about recovery centers is, you know, a, like appointments for services are different than treatment. Like people make their own appointment, like they choose when they come to the recovery center. They choose the activities they want to do, and a lot of times when we don't have activities that people like, they sort of criticize us. And that was like my favorite thing when I was in the recovery center running it, because then I would just say, well, why don't you help me do it? And then it provide a real leadership opportunity for people to get involved. And so we're always trying to be responsive to what the recovery community wants. And we have a structure in place where individuals who come there, they get part of our recovery activity committees, and they help design the activities, the meetings that are there. So they're always responsive kind of to the geographical location and the phenomenon of like what people want at the time, because we're leveraging those people who come to help run the recovery center. They're on demand, they're long term, and then people, like, the coolest thing about it is like people prescribe it to themselves, right? Like they're like, this is how much I'm gonna go. I'm gonna go 3 days a week. I'm gonna go 5 days a week. I think I need to go 7 days a week. I need to get a service position here. you know I want to go to Narcotics Anonymous or AA, or I don't like 12 steps, so I'm gonna go to something else. Like I'm gonna go to the Wellbriety meeting, or like whatever. Like they get to choose what they want to do. And our goal is to pack these recovery centers full as many different kinds of people that we can. And then with the peer mentors we have there, bring in people in early recovery to meet and socialize, build friendships that they can leverage to help their recovery. And so that's the difference. And so the goal isn't graduation, the goal is retention. We want to retain people for as long as we can. You can go to the next slide, Max. So we're designing this adolescent and family recovery campus right now. This is what it'll potentially look like. It's in Northeast Portland. I'm really, really excited about it. Really nervous. It's the biggest project I've ever done, and it's cost incredible amount of money, and I'm having to fundraise a lot for it. But I'm super pumped. I went on a national tour around the United States and visited a bunch of different programs all over the place in different communities and took all the best ideas and coupled that with some of the best and brightest people I know here and individuals in recovery and current clients of our adolescent outpatient recovery services, and sort of had them put the final touches on everything. So we made sure it was really, really, really cool. You go to the next slide. Here's our mission and vision. Probably should have covered this in the beginning, but really our vision is like a future where like systems, communities, and individuals work together to ensure people receive the care that they need. And that's really important to us because we understand that we are not the silver bullet for everything. We understand that addiction and mental health are very complex issues, and they change, and how support is given to each individual. So we really try to partner with everybody. And so we collaborate with systems, it'd be like hospitals, local government, ODHS, criminal justice system, like whatever. We want to partner with these systems, develop policies and practices and partnerships that help people recover, and then communities, and that's the natural community, to whether that's the recovery community or the community at large, to play a role in it. We understand community plays a role, and then individuals, to provide these comprehensive services that help adolescents, young adults, and families recover from substance use disorder. And that's important for us to remember. It's as you run a business, you can become very focused solely on your own profit and loss and cash flow statements. But for us, we see it as a partnership, and so we always want to be looking out for what's the best interest of the community. And what I found is that in that approach, and when you serve clients really well, and that's your focal point, the funding, it just comes with that. It's like goodwill. So that's what we found. Yeah, go to the next one, Max. Just to do a little deeper dive on I want to do a little deeper dive on adolescent and family support services. So the sort of the maturation of where we're going, like maturing as an org, is with adolescent services. We started with a drop-in center a couple years ago, and what we found was that just having the drop-in center, it didn't really work. And the reason was there wasn't the treatment services available for adolescents that were going to send us the people who are kind of already on the road for recovery. And so we're trying to do like acute care services, which is in the recovery center, which we just don't have the tools to do that, right? The peers just don't have the tools to do that. And so that, coupled with parents, some of our donors, and some government officials sort of pressuring me to develop treatment services, resulted in us getting some investments from government, from Medicaid, managed organizations to launch treatment services. And so we did that, the outpatient. Now that's gonna then translate, the whole thing's gonna translate into the campus, which I'm gonna talk about in a second. So go ahead and hit the next slide, Max. We had some successes with our peer support. Clients were engaging in school. A a large percentage were reporting improvements in their family dynamics. Uh, Clients were achieving their defined goals. And then the 102 days, there was a group of adolescents that were really strong in their recovery and achieving a lot of sobriety time, which kind of skewed this data for 102 days. But then a majority of them were really struggling to get stable, and they weren't able to get the services they need. And so, our initial outcomes were like, we're doing great with a few of our clients, but we don't have the infrastructure to support them ourselves. And then more broadly, from a systems perspective in Oregon, there just isn't the infrastructure available. I don't 100% know how other states are. I know in Washington State, there isn't a lot of adolescent services. In Oregon, what I found is the profit margins aren't really there for a variety of reasons to make treatment services pencil. And so the reimbursement rates, there's no differential to pay a higher reimbursement rate. That's going to account for some losses on the operational side. Some of the losses are going to be reduced engagement, increased administrative work that's not client facing, cost with transportation. You have to have a pay differential for staff to try to recruit them to work with adolescents. It's been my experience. It's a very unique role. And not everybody wants to do it, and it's tough to work with kids. There's a lot of emotional strain working with them. And so there's some systems issues that we have to have a healthy system of care for adolescents. We launched a campaign to address that, create political buy-in to it. We helped support our Alcohol and Drug Policy Commission in Oregon. That's a citizen commission that oversees policy for substance use and misuse in Oregon. I chair it. We just finalized our strategic plan for the state, which has a separate sub plan just for adolescents. And then we have some legislative support, some community support that's sort of banding together right now, which is important with the changes to Medicaid that's coming. And so I think there's traction to address the shortcoming in services, but we live in a time where it's like you don't know what's going to happen next week. But my read on it is we're going to be okay. I can go to the next slide, Max. So really the special ingredient, I believe, for adolescent care is really this positive peer group. In places like Texas, for example, they really talk about alternative peer groups. And for us, it's really how do you provide the opportunity to help adolescents achieve recovery, be thriving in it, and then introduce their peers to them while they start their road for recovery. So that's really what we want to do. We want to build a leadership group within our clientele that can help coach and support the new clients who come in. And I really believe that's the secret sauce. That's not to say that clinical interventions aren't important. They're incredibly important. They're very helpful. They were very helpful for me. But I think the secret is really the community aspect and the buy-in so that they support each other. You can go to the next slide. So we're going to be bridging together the clinical and social model of recovery. So in this campus, we'll have substance use and mental health treatment services. We'll have the positive peer sober support there. And then we'll have these family support services. And this is going to be in conjunction with the recovery high schools that are in our area. We're still fleshing out some of the details on what we can and can't do. There's some sort of bureaucratic barriers to, getting the local school district from that operates the recovery high school to send us over a teacher, right? To teach some credit recovery classes, why individuals are an outpatient so they can meet requirements of their outpatient treatment plan, while also, doing some work on their educational goals to recoup some credits and stuff, get them back on track to graduate. But that's how we see ourselves, like this collaborative model, providing as much efficiency as possible with the multiple systems that adolescents get caught up in and have a hard time navigating. And then we have the family support services, which has really been a thorn in my side to try to get right. And my vision is that just how the people in recovery find a community to support each other, I want to create the same thing for parents, provide them the clinical support, the craft skills, stuff like that, but really get them a community so that they can support each other. And the issue has been getting the parents there. And I think we have to just be much more demanding of the parents when they come in, or the caregiver, whoever the person's caregiver is or support person. Not all the adolescents we work with have parents supporting them. Some of them, are in foster care, living with an aunt, whatever. It's like we just got to get somebody, a teacher, a coach, a mentor, best friend, like somebody's got to come. We want somebody to come who can support you. And so we're still trying to fine tune that to really get that launched and really successful, but we're going to do it. You go to the next one. Kind of talked about this a little bit. We'll still have our outpatient mental health services, and then in this model, we'll have our residential and detox services there as well. We'll have 14 beds that are flexible for withdrawal management or residential that we can use whatever people need at the time. One of the really cool aspects of the campus here, and I'll show you a little bit more when we get get to a future slide, but we created like almost like a drop-in center in the residential aspect that's separate from the living quarters. So they just have a place to like kick it, and it looks it looks really cool. And there's like graffiti on the walls, and it's just like it doesn't look like an institution. I went to residential treatment, when I was a kid, and it was like going to jail. So we don't want people to feel like they're going to jail. We want it to be a fun, cool spot to kick it, enjoy themselves, have activities, have fun stuff to do, while also maintaining, safety and security. So you go to the next slide. So that's what it looks like right now. And if you look at this picture, what you can see is the far left L that kicks out. That's going to be the drop-in recovery center over there. This building, 16,000 square feet. The lower section from where that window protrudes out, I don't have my cursor that you can see, but the lower section where the window protrudes out, yep, down along there, that's going to be the residential. And then the upstairs component, that's going to be our big outpatient. And so the idea is we'll have the recovery center pop in, and there's a family place in the recovery center that we built. We built a kitchen too. We got some local chefs that are going to be doing kitchen classes and stuff. We have a family space too, where we're going to have family support groups and a kind of a spot for them to kick it that's separate from where the clients will kick it. But we want that space to just be popping and cracking. They can do their homework. Like we could have tutors over there, like whatever they need. We're gonna make it really, really cool. Pizza, barbecues, like whatever. And then the adolescent residential clients and the outpatient ones will get introduced to that. And what we speculate is that we're going to have a higher retention rate and higher engagement rate because it's going to look cool and it's going to be attractive. You go to the next slide, Max. And so here's the renderings now of kind of what it is going to look like. Some of the colors might change and stuff like that, but we're on schedule right now to open in March. We got a bunch of bureaucratic hoops to jump through with the city. I don't know if anybody's done any projects, but it can be difficult to get through all the permitting processes. But we got local support from our mayor who's helping us get through that. and we're doing construction right now, and we're really just really excited to bring this service to our community. From my understanding, it'll be the only service that has all these different parts that I talked about in one location with uh, in conjunction with the recovery schools, and we're really excited about it. We'll open up in March, and we'll have a lot to learn and ways to improve. But it's a cool resource to come into Portland, and I'll pass it off to you, Max.
Thanks, Tony. Yeah, I'm super excited for all of the campus to come on board. It's been, just a big growing process forever, right? Since the beginning. Started as a meeting, became a center, became so many centers, became treatment and centers and housing and treatment and centers. So it's been really exciting. So if I can get back here, there we go. So I am the HR director. Obviously, my role is a little bit different than most of the people who we get to work with or interact with. As HR, I think HR as a field gets a pretty bad rep, and I would say that's sometimes pretty fair. People don't always have the most positive experiences or associations with this department. So what's really important, to me as an individual, and part of the reason I came to 4D is being able to be really employee focused. So many of the things that are important to how we operate in terms of our services, like Tony talked a lot about the collaboration pieces where people, we need our clients to be invested and collaborated, collaborate with them to build the services that they want to see. That same thing is really true for our employees as well, and being a team instead of just being, a company with that top-down kind of model. So what I'm really going to focus on today to kind of sum it all up is just our focus on culture, right? Same thing with our services, where we're really focused on creating that exciting, fun culture for clients to engage in. As an employer, we're also focused on the culture that our employees and our teammates get to engage in there. So we were recently certified as a great place to work through the organization Great Place to Work. That is based off of an anonymous survey sent out to all of our staff, and just goes to show that our staff agree that we are indeed a great place to work. People have a very positive work experience when they're on our team. We were also recently highlighted as a top workplace in the Oregonian. We were in one of the top 10 workplaces for Oregon and Southwest Washington mid-size employers. In addition to that recognition, we also got a special award for training, specifically meaning that employees agree that we support them not only receiving the training they need to be successful in their role, but also to achieve their longer term career goals. And that's been a big part of who we are. Another similarity there is Tony talked a lot about, while we're very focused on the services that we provide at 4D, another really important piece is improving the community as a whole, whether that's through legislation or collaborating with other organizations and teams to build out better services just that are available in general, even if they're not specifically coming to us. That's another piece on the employment side, is that we are working on developing all of our employees. Even if they're eventually going to leave, we know that they're going to be a benefit to the field as a whole and continue benefiting the clients that we serve. So the way that I'm kind of breaking this down today is through three things. First is developing the culture, right? Mainly focused on building your policies and strategies for recruiting. So essentially how we're getting people on board, and then maintaining that culture, right? So usually that's looking at things like corrective action or communication practices, just in general, how we retain the people, how we retain the culture that we've built. And then extending the culture, right? So professional development, support for employee growth, and improving the workplace as a whole for the long term, even beyond 4D recovery. So how to develop a culture, right? This is something we could talk about for weeks or months or years. So to try to sum it up into just a few minutes, some of the main pieces that have been really beneficial for us is focusing on our mission and our values. Being able to focus on what matters most has really helped to narrow the candidate pool down to people who are actually really excited about what we're doing, right? Down to people who care and they share those similar values. So as an organization, we are recovery led across our whole range of services for clients. So even, on the clinical side, it's always through that recovery lens, or housing that is through the recovery lens. So the same thing when it comes to our employment and our workplace philosophy is making sure that we're still applying that same mission and values to everybody who works with us. Another piece that might seem pretty obvious is positivity, right? Positivity is a really attractive quality, but it's also just really beneficial. If you think about interviewing somebody, if you are coming in with this attitude of thinking that the candidate's going to do really poorly, they're probably going to do poorly. Whereas if you're able to maintain and focus on that positivity, it helps you to see things in a more creative way, or find the positives that might be underlying. Representation is a huge part of developing a culture, right? So making sure that everybody that you're putting in a leadership position helps actually reflect the type of person or individual that you want to hire. Not only do they have to represent it, but they have to reflect those values, right? They have to really share and embody those values that we want to see in our teams. So in our case, that looks like talking about recovery regularly, every level of leadership, talking about why recovery is important, how it got us to where we are today. Things like that make a huge difference in terms of showing prospective candidates or people who might be interested that we are walking the talk. Benefits, another really important piece here, showing that we care, right? That we have to understand that employees can't do the work, right? Peers can't support their clients if they don't have the benefits they need to be a healthy, well person. So for us, that looks like providing well-rounded employer-sponsored insurance benefits, making sure that we include benefit coverage as well, or excuse me, dependent coverage as well. We've seen a lot of folks coming into the field are looking for an employer that's going to support them starting their family, especially if they're in the first few years of recovery. They may just be first developing a family now or bringing their family back to them. So having that dependent coverage has been a really important piece, but also making those benefits accessible by providing education about what they mean, right? Because insurance is confusing to every person, let alone somebody who hasn't had, employer-sponsored insurance before. It's important to educate people on what a deductible is, what an out-of-pocket maximum is, why it's important to know those terms. Paid time off is the next one, right? How accessible is that paid time off? Are you offering anything beyond sick time, PTO, getting creative again, like floating holidays? We started adding floating holidays so that people could always take a day off for their recovery birthday and their regular, belly button birthday, all those things that are really important to each individual. So really respecting who they are without having to use like PTO or sick time. It's just something that we add in addition. It all goes into calculating like, how is this workplace going to benefit me as a whole person when I'm choosing a place to work? We also offer an EAP, an employee assistance program that makes therapy and mental or behavioral health very easily accessible, right? There are a ton more benefits than that, but as we know, peers or other individuals working in this type of position or healthcare, we experience a lot of vicarious trauma. And so it's been that much more important to not only have the benefits, like insurance benefits to make sure that people can have a therapist, But having that EAP means they just have to dial one number and they're talking to somebody right away, even if they didn't choose to enroll in insurance, even if they didn't choose to, get a therapist set up ahead of time, making that just easy. And then finally, wellness, right? Just kind of sums up everything, but how are you supporting them in supporting themselves in their individualistic ways? So for us, we provide a wellness stipend to all of our employees to make sure that they're, going to the gym or taking a yoga class or getting a massage, whatever it might be, to take care of their whole self that, doesn't fall necessarily under health insurance or taking time off, just those little extra things. The last piece is reducing unnecessary barriers, right? When we're talking about lived experience, sometimes that can come with a lot of other barriers that they may have faced or may currently be facing. A lot of hiring practices just in the general world, right? They serve mostly to make the application process more difficult. So that we're seeing like this person must be really dedicated because they managed to craft a resume, write a cover letter, contact a whole bunch of people to get them to agree to be references, all of this sort of stuff. So for us, we've taken some steps to reduce those barriers where we can. Some of those steps might include reevaluating required job qualifications. Does it actually require a high school diploma or a GED? Does it require a bachelor's degree or an associate's degree? What is actually needed in order to be a qualified, for example, peer mentor? Probably don't necessarily need those qualifications as requirements. Also want to edit your application process, right? Make it as simple as possible. If they have to click through 10 different pages in your job application, it's going to lose some people pretty quickly. And update your screening process, right? I've talked to some folks who, if you, for example, if you recruit using Indeed, you get 100 applications, probably going to just look through resumes at that point. But then you're going to miss out some really qualified individuals who maybe haven't written a resume before or haven't written a cover letter before. Things like that are just really important to consider. Some examples of this, we have a few times now, we've hired individuals directly from incarceration, which requires mitigating some pretty significant barriers, right? If you have an online job application, people who are currently incarcerated definitely don't have access to that. So how do we allow, how do we get them a job description or get them a paper copy of an application or allow them to do a screening without being able to, pick up the phone automatically? All of those things are just important to consider when it comes to developing your culture in the first place. Maintaining that culture, most important pieces I see are that collaborative environment, right? You can do that by having an open door policy, anonymous feedback opportunities, just making sure that everybody feels invested in their work when they know that their ideas are getting heard and they're valued. Consistent feedback and opportunities for development, right? We can't expect people to be perfect right off the bat. And it's really important to share with the employee, keep them informed how they're doing, what they're really great at, where they could improve, and, keep seeking requests for support, but also offering that same support back to them. Maintain that commitment to your values and the mission of the organization. Make sure that we always come back to that and invite our staff to comment or give us the feedback if they feel like we're straying from that in any way. Again, that helps them feel more invested. And then the last piece here, getting really creative with your solutions. So this applies to basically every area of everything we do, right? Whether it's a conflict resolution, if we've got a couple employees who are bickering, how can we resolve that in a way that's helping them feel actually closer together as a team and motivated to work together versus just slapping some warnings and moving along. Finally, extending the culture, right? Mainly focused on professional development here. So we will encourage and offer continuing education for all of our staff all the time, whether that is, continuing education opportunities to just maintain their certifications or creating an individualized career pathway right? So we at 4D, we have scholarship opportunities for individuals to apply and say, you know, I really want to move into a clinical role at some point, and we'll help provide either funds to get those classes or flex their schedule around to accommodate a school schedule, but also a path towards supervising or administrative roles, right? Because peer mentors could be a pretty low barrier, maybe first job for somebody as they're entering into recovery. Maybe that's not something they want to do forever, but it's a starting point. So we'll work with them, and maybe they're actually really interested in finance or operations or HR, right? Then we can work with them to set up some shadowing or scholarship opportunities for additional training. And that's just a really important piece to help people both feel supported, and then also then we're creating these really strong individuals to either, you know, move up within our organization or move out into the rest of the field. With succession planning, the idea of like making sure that you've already got somebody who can replace another important person when they're ready to move on for any reason, whether they're stepping up to a new role, moving to another organization. If we're continuously upskilling all of our staff, then we can expect they're probably going to be ready to move on at some point, right? It's a good thing, and it's bittersweet. But at the same time, that means that we've also got other people working with them that are going to be ready to take over when they're ready to move up. Okay, so in summary, and I don't remember if I have it. Yeah, okay. Our focus is really on recognizing, supporting individuals for who they are, using that recovery lens on every aspect of our employment process. We want to hire peers for who they are, right? Not for their certifications or their previous work experience, or really anything else. We're bringing them on for their personal identity and lived experience. So in order to attract those people, we need to have a baseline of support when it comes to benefits and just the culture in general that we are displaying. We want to level set expectations, both internally and externally, right? Not every person with valuable lived experience is going to have the same level of access to personal and professional development. So it's really important to make applications accessible and make all the other resources accessible. Once they are hired, make sure that they receive all the training and the support that they need to be successful. Again, remembering that possible lack of experience. So meeting people where they're at. And then keeping people informed on what's going on in the organization to make sure that we can keep their trust and their security. Next is get creative, right? Everybody's got a unique background and a really unique skill set, which is amazing, and will also reveal unique problems and disagreements. So we really have to get creative when it comes to finding solutions for those situations. Again, you can't just like slap a write-up on a problem every time there's a mistake or a disagreement or anything like that. It's time to really get creative and think of ways that we can help support everybody. And then the last, maybe most important piece is focusing on that professional development for all the time. Continuing education, as we know in the field, is already a best practice for every type of role. But individualized career pathways can help keep people motivated to either stay in their role or develop beyond. Upskilling all the staff all the time helps to prepare us when higher level staff are ready to move on. And it also just helps improve the workforce as a whole in order to better serve clients and our community in general. Thank you. That's been a speed run, but I will pass it back over. Thanks so much for hearing about HR today.
Awesome. Thank you.